Well, thank you, and welcome everybody to this webinar. Dr. Castro, I'm so glad you could do this and be with us today. IMHR was founded 20 years ago. I was one of the co-founders at the time. In those early years, there was a lot of discussion about where mental health should go, where research should go. As I think many of you that are on this webinar know, mental health has been greatly underfunded over many years when you compare this to cancer and funding and other types of illnesses. I think in the last 20 years, we've made an impact in Arizona. We've raised, I think it's somewhere in excess of $5 million. We've funded somewhere in the range of 50 scientists. And we're proud of that. We also have a mission to provide these types of educational seminars, which I think have become even more important during COVID. So nobody wants to listen to me, and everybody wants to listen to Dr. Castro, so I'm going to introduce Keith, who is our Chief Scientific Officer, Dr. Cernick. He directs our grant award process. He's also the former chair of psychology at Arizona State University. And I'll just leave you with this one last thought. These webinars are free, and we will continue them next year also free. If you have suggestions for future webinars, please email us and let us know what your suggestions would be. And obviously, we'd love to have contributions as well, because these do cost. So with this, I'm going to turn it over to Keith.
All right, Mike, thank you so much. And it's indeed my pleasure to be able to introduce our webinar speaker today, Dr. Felipe Castro. Felipe and I have been colleagues for many years, actually, going back to the time where we briefly shared some time at the institution that actually trained us in our profession at the University of Washington. But Felipe is currently a professor in the School of Nursing and Health Innovations at ASU, and a Southwest Borderlands scholar. I'd say that Felipe is also on the faculty at the Center for Health Promotion and Disease Prevention, something which is going to be very germane to what we're talking about today. Now, Felipe has had a very distinguished career, and he's held a number of positions, faculty positions, professional positions, from UCLA to ASU psychology. And Mike mentioned I was the chair of psychology for a while. And one of my failures was letting Felipe actually escape psychology at ASU when he took a position to head the psychology department at the University of Texas, El Paso. And he was there for a number of years before he decided he really did miss Arizona and was coaxed back, right, to his current faculty position in the School of Nursing and Health Innovation. Now, Dr. Castro is a preeminent clinical health psychologist, right? He's nationally recognized for his work in resilience, and particularly stress and coping models of resilience, for adaptive health outcomes to help us better understand how people adapt to the kind of stressors that they face and what the health implications of that adaptation is. Further, one of the great expertises that he brings to the table is a focus on cultural adaptations for evidence-based interventions. And this is particularly important because we know there are very important health disparities depending upon the population that's being addressed. And for Dr. Castro in particular, that has to do with Latino and studying Latino populations and the health disparities that are involved, and understanding the way that we can adapt interventions to better serve those populations. Now, he's published extensively in these areas. He's been very well funded historically. And as a matter of fact, he was one of IMHR's early funding recipients, right? So we're proud that we were to be able to have contributed a little bit at least to Dr. Castro's careers. He's won many awards in prevention research and from National Hispanic Science Network. And he's here today to share his amazing expertise. So please join me in welcoming Dr. Felipe Castro, who will present resilience in response to highly stressful life events, approaches for coping with COVID-related stressors. Dr. Castro.
Well, Dr. Cernick, thank you so much for those kind comments. And I'm so happy to be here, and thank you to Institute for Mental Health Research that provided me the opportunity to do so. What I will be doing here, let me share my screen. And I have a presentation that I want to put things on the table, but the key thing is to be able to have a nice period of question and answer at the very end. So I'd like to do that. So let me begin by sharing my screen here, which I will do in just a second, so that we can get into the process of let's see, going through this. Okay, I hope you can see that. Let me make it into the full screen. Backing up a step here. Okay, there you see the screen and the title of my presentation, Resilience in Response to Highly Stressful Life Events, Approaches for Coping with COVID-Related Stressors. And at the very end, I want to introduce some ideas that relate to the COVID pandemic, which of course has affected so many populations, but specifically even more so vulnerable populations of color. So with that said, let me advance. Let's see, there we go. This is my outline. I'd like to talk about basic definitions and approaches looking at stressors, coping, and resilience. Then the second part, our own research regarding these areas, some general implications based on the information I present, and then moving into implications in relation to the COVID, and finally, some questions and answers. So I will go quickly through my presentation with the goal of coming back to any slides that will be of particular interest based on what you in our audience would like to discuss. First of all, I want to thank the Institute for Mental Health Research for funding a study titled Resilience in Hispanic Leaders. And I'll be presenting some of that information today. We're coming back and reanalyzing or analyzing more of these data with new technology that allows us to probe even deeper into the issues there. So of course, they funded this study that basically looks at community residents and leaders for a deep structure analysis of the process of coping with highly stressful life events as related to resilience, adaptive growth, and well-being. And we take a positive view here because what we want to do is not look at the pathology, but rather the ability to survive and do well. And that was one aspect of that is, of course, resilience. Part one, about stressors, coping, and resilience. Here you have some definitions. I won't dwell on them, but one distinction to be made is between stress, which is an internal state of tension and anxiety, and then a stressor, which is a trigger outside in the environment typically that produces that. By contrast, coping are basically ways of dealing with a stressor. And there are three basic areas worth mentioning. Direct action, as in problem solving or help seeking. The goal is that you do something to get rid of that stressor. Inaction, avoidance, denial, and escape, those are patterns to go away from it for various reasons. Direct action is typically better, but not always. And inaction is not quite so good, but sometimes it's exactly what's needed. So you can see things can get complex very quickly. And then adaptation is finding ways to accept or otherwise rethink the situation based on the need to deal with it because it's not going to disappear very easily. Regarding resilience, which is one of the focal points here in this presentation, that's adaptive growth in response to challenging life conditions, but it takes different forms. One of them is a trait. People do have certain skills and competencies that allows them to express that resilience. And so it tends to be trait-like, but resilience is more than just a trait. The other is the response. As I mentioned, the expressions of resilience. People don't necessarily express resilience if they don't have a trigger that forces or requires that they do so, but that doesn't mean it's not there. Some people do it well, some not so well. Outcome has to do with what happens at the end of the pipeline, and you hope that it'll be a positive outcome, such as growth or positive change. And we look at that in our research. And finally, the most complex is the notion of a complex process of grappling back and forth. It's dynamic and it goes on for a while. So those are different approaches. I want to mention our mixed methods approach, which is I find it important for probing deeper into some of these complex issues. And what we do is we have quantitative data, and I'll show you some of that, and qualitative data, which are stories that people tell us. So in the quantitative, we get the benefits of precision and measurement and numerical data analysis. The qualitative, by contrast, is the stories of human experiences that, in quotes, brings to life that experience. And what we do is join them. It takes effort, but it gives us a bigger bang for the buck, what we call bigger yield. And so the study that I'm doing has these features with the idea of really understanding in greater depth the core features that distinguish persons that have higher capabilities and express resilience well versus those that may not do as well. Part 2, our research on coping with highly stressful life problems. I want to share with you some of that research in simple ways, although there's numbers and data, but I'll just go over it briefly. One question is, how do you design a study to look at issues in the way I mentioned? We developed a part of a study that focused on this, and we called it the difficult problem. And the goal there is to understand the psychology and relationship issues by looking at what persons did in terms of their thoughts, their feelings, their actions, and then at the end, looking back on what happened, and we called that reflections. We wanted to understand what growth or change might have happened as the result of going through this very difficult life event. And the question is, how do we organize all of this? A lot of moving parts. This, of course, try to make it simple, but let me walk you through in terms of understanding the process that we want to look at. This is a 5-stage model that builds on previous models that have more details, more complex. But this, you might think about your own situation sometime in the recent past where you went through this process. The triggering event is the stressor, and that kicks on the need to think about what's going on and the feelings. And you see the up and down arrow means that when people encounter a stressor, they go through a process of turmoil. They're thinking, they're feeling, they're feeling, they're thinking. So it's not a linear process, but ultimately when they begin to come out of that circle, they take an action, they do something or they try to do something. That action could be attacking the stressor so that they can get rid of it, or it could be going away from it. And so those actions are some of the things mentioned before. The end result, we call it an outcome. These are the results, and they can be basically 3: improvement, no change, or worsening. And then, of course, after that, things begin to clear to some extent. The issue is, does the person reflect on it and actually become strengthened by doing that, new perspectives, or is somehow weakened by whatever happened before? If we collapse that model into 3 parts, which is what we're doing in our data analyses, you basically can see the stressor, that's one piece of the action. And there you see one fork in the road is whether it's changeable or not changeable. And there's different examples there. For example, a health problem can be resolvable. That's changeable because you can make it go away in time, or unchangeable, chronic, and you have to find a way to adapt to it, to manage it. The coping process, those are stages 2 and 3 in the previous model. And that's what we're looking at in depth: thoughts, feelings, and actions. And then finally, 4 and 5, those 2 stages collapse into 1. These are the outcomes. And as mentioned before, strengthened, new perspective, or weakened. So the question is, how do we design a study to build on that model or that approach to understand resilience? One of those is something called planned sampling, or another way to describe it in more technical terms is purposive or purposeful sampling. You on purpose pick 2 groups that you want to contrast. We did that in this study, looking at the highest resilience leaders contrasted with everyday folk that are not quite as accomplished, but they still are doing well in the community. So our study consisted of 43 community leaders and 44 community residents, roughly in equal numbers in terms of gender and age group. This is the actual picture, a screenshot of the actual question that we presented. We do this data gathering by interview, well-trained interviewers that know how to probe, and these are the questions. I won't dwell on them, but you can see that we go backwards in time and then ask them to focus in on that event, take themselves back in time as much as they can, and ask what happened, when it happened, and what happened, as you see there. And then at the heart of that is the stressfulness rating in terms of how much they felt that the situation was either not stressful
for the students.
and what you did.
Because I had the paperwork, so they were going to be emailing me questions and things. So that's why I said.
Okay. So now this is getting to what we did, and I'll show you a busy slide, but just to walk you through a little bit so we can keep going forward. One of the challenges is what measurement of resilience is going to be used in the study.
Absolutely.
And for that, what we really have, what we did is we have 3 ways of measuring it, and then we combine them in an algorithm or a mathematical formula by self-report of the people that did the interview. That's the person who participated. The interviewer rating is the second one, and they don't always correspond 100%, but it's another way of looking from a different angle. And then the clinical case ratings, which the research assistant and I worked on these to rank order the individuals by the whole case. And these 3 integrated into a common measure of what would be resilience. And then we wanted to stack those individuals or cases by the highest to the lowest, as I'll show you in a bit. The severity and stressfulness are 2 dimensions of how bothersome the problem is. And then finally, there are issues of if a situation is very threatening, that makes it more stressful, but also can you control it? And that reduces the stress. We had some measures there of that. And finally, problem solving coping, that was our hypothesis. Do leaders engage more in that? What we see here in the check marks, those are the dimensions that are statistically significant. And the 2 that are below the pink line are threats of the problem. Leaders in the problems that they reported were statistically more threatening or threat value than the high resilience group, higher than the low. And the other is problem solving coping. We did in fact through this measure find that high resilience individuals, mostly leaders but not all, had a higher problem solving coping approach than those that did not. With that said, this is a very busy slide, but what I'll call to your attention is the 2 groups. The high resilience group, which is the one above the blue line, and these are the individuals that, if you see the 3rd column there, these are the composite scores. So the highest was 5.13, as you see there. That was the case of an individual who was dealing with a problem of death of spouse or wife. And the basic approach to coping was being more philosophical. The theme that emerged in our analysis of the things that he mentioned in terms of reflections was insights. He had more understanding of what was going on. By contrast, here is the one, let's say 60, the problem was cocaine abuse. And the person says a new attitude towards life. He was the highest ranking, as you see by the score of 3.56, of those in the lower rung. But then the person at the very bottom, 1.80, anxiety disorder, and felt more compassionate. The themes are the emerging pattern of response that we have. And I'll talk about that in just a bit. The storylines at the top and bottom above the blue and below the blue line are basically the summary. I'll read those to you. The higher coping individuals at the top, the prominent theme was optimism, gained insight, and empowerment. Another issue, appreciations for life, work, capacity for recovery, despite having a disease or some problem that's chronic, and some cases, some cynicism. That's to be contrasted with the lower ranking individuals. What profile do they provide? The prominent theme, interestingly enough, was no growth. 3 of those simply said, I didn't change. And so they also talk about insights gained from coping with a difficult problem, but the growth seemed to be really minimal, as you would see. And time doesn't permit to go through these, but as we do, you get a very good feel for the big differences in the 2. The basic difference is the leaders are proactive. They do a lot. They also look backwards and learn from the experience. The low resilience people did not. And that's one of the big differences. Here I summarize it, and so I won't repeat that. But again, it's the distinction between the two. We were fascinated by the notion, how do you understand the two? And these patterns replicate as you go across the cases. Those are the themes. Central implications. Where can we go from here, from these findings? These are just a piece of the ice, the top of the iceberg. We have so many other findings that we will continue to look at based on the model. I only showed you the last part of the model, the reflections part, but there's other pieces that we're looking at as well that come before that. Some issues and observations. How do you cope with a difficult life problem? I'll talk about some of these. The challenge of emotional self-management. When you see something that's threatening, you get anxious, you get fearful. How do you suppress that for the purpose of figuring out what to do? Next bullet, for a planful problem-solving approach. That can include seeking help. Also, better approaches are flexible. They vary across time. And so you have various types of coping activities in one stream of problem solving. Reflecting, as I mentioned, is very important and done much more so by people that have high resilience profile versus those not. One caveat, we all have our limits. So the prolonged exposure to the stressors is a very important issue, because to the extent that an individual has more exposure, they can develop trauma, for example, in the form of post-traumatic stress disorder, which is a much more ingrained difficulty, which is hard to get away from. So one of the goals is to reduce exposure to toxic stressors for a prolonged period of time. Otherwise, the person may develop some of these longer-term symptoms. And of course, there's a need to get away, repose, relaxation, to avoid this overload. Implications for COVID, my last section, some key thoughts. Busy slides here, but the challenges of emotional self-regulation, of risk, uncertainty, and threat. Currently, many individuals throughout our nation are anxious, and for good reason. There are so many unknowns, so many things that can be threatening. And so trying to control your emotions in a positive way is one of the challenges. Hard to do, but it can help you at least to stay above water, so to speak. Health disparities, that is so clear. Frontline workers are those at highest risk, as you may know, and many of those are individuals from racial, ethnic, minority communities. At the bottom, I have a short but very informative article about the pre-existing inequities that occur in many of these communities. So the existing toxic stressors are magnified by the COVID. And that's been something that was seen early in the epidemic, and it continues. Differing perceptions of threat. Some people say it doesn't exist, it's a hoax. Some people see it graphically because a family member or loved one has been sick or has even died. And so you see that we have a very differential response to this epidemic based upon various reasons. Finally, the problem of limited control over the pandemic. That can be a source of feelings of helplessness because you don't control it unless you do certain things that give you some semblance of control, like wearing a mask. So finally, some questions to ponder as we move into the the time where we can discuss these in open-ended discussion. What interventions can be designed to actually inoculate people from some of these negative toxic effects of stress? Bullet 2, what new knowledge is needed to enhance treatment and prevention so that we can increase the resilience population-wide? And finally, what policy initiatives are needed to provide sufficient resources to state and local communities so they can implement mental health interventions to help those communities in need? And that's my presentation. I'd like to transition with our other members of the team for the interactive discussion, and happy to answer questions as they would come up.
Thank you, Felipe, very much for that presentation. That was fascinating. You know, a number of things, right, occurred to me having listened to what you said, and I wonder if we could just talk about them just a little bit.
Sure.
Some of them have come up in our previous webinars, right? But one of the things that I think really stands out about this is the novelty of the stressor of the pandemic and COVID-19, right? So this is not something that individuals have had experience with before, right? So there's something now that we're all facing that we really haven't had a chance to face before. So we can't necessarily think that we can rely on learned kinds of coping things that have worked for us in the past with some stuff. But do you think there's any importance to the idea that COVID and the pandemic and what we face because of that, right, presents some sort of novel challenges that make coping more difficult for people? Or could you maybe speak to that a little bit?
Sure. Novelty can be an interesting issue, but it can also be a source of fear and distress when you don't know what to expect. And that uncertainty, all the way from early days of psychoanalysis and otherwise, shows that anxiety occurs when there is too much unknown and the person sees it as risky, a threat, but also knows not what to do about it. And I think that that's a part of the pandemic, not only the virus, but the issues that are so novel that many people don't know how this virus is going to act, because it's a different kind. It's a virus, but it has properties that are much more infectious. And that becomes a source of concern and fear. So yeah, it is really a challenge to manage one's feelings, emotions, and know what to do, given the different features of this pandemic. And that includes a lot of conflicting information that has also made it even more anxiety provoking, because what is it that you should do? Should you wear a mask? Should you not? And so those are conditions that have amplified the mental health challenges and issues that many people face.
Right, and so that's an issue that has to do with, to me, with it seems too, about what you talked about the degree of threat that really one experiences, right? Because you're sort of dependent on a lot of other people in your community and your neighborhood, and who are behaving in ways that don't create greater kinds of risk for you with this pandemic, right? So one of the things too that I was wondering about too, as you were talking about this, is resilience as an idea. Is this really a function of just how good of copers we are, or is there something else to it that we need to know about?
Well, as I mentioned, that there is a little bit of trait to the notion of resilience, but we don't know how much of the piece of the pie that really is. Mm-hmm. It is true that what we see in our own data, that those that are the better copers, and then apparently certainly more resilient, seem to go back and make sense of the experience. And that's what Shelley Taylor, another health psychologist from UCLA, talked about: meaning making. That you find ways to understand the situation, even if it was not positive for you, but you reconcile to the acceptance of it. And so by that, you do grow from it. So there are features of the person when they're used to doing that, or they try to do that. However, there are other conditions that are important. For example, a person can be very resilient in situation A because they know what to do and they're very good at it. But put the same person in situation Z and it's wholly different, maybe such as this pandemic, that capacity to be resilient is not so clear anymore. So they're not going to be at the top of the heap like they were in situation A. You can see that there is a systems analysis needed to fully understand what's going to happen. But what it does, it makes it more complicated. But that's where in our work, the stories that people tell will give us a lot of detail that helps us understand these nuances or complexities that are part of understanding what is resilience, how can it be expressed, and how can we bring it into an intervention so we can help people be more resilient, understanding that they also have to be sensitive to shifting environments and new conditions for which there isn't an immediate answer what you should do.
Right. So, I mean, I don't want to take up all of the time. I have one more thing I want to talk about, and then I know we're going to have a number of questions that folks want you to answer. But one of the things we hear about a lot when people say, oh, like he's resilient or I'm resilient or things, it makes it sound like it's sort of a you either have it or you don't kind of a thing. And so I wonder if you could just talk about whether or not somebody can be kind of resilient or sort of resilient, or resilient in some cases, but not others, right? Or is it a quality like that trait of resilience? Does that, if you have it, are you good across all stressors that you face, or are there some that you might not be good with, or just how do we understand that?
Well, I mean, certainly in psychology, we have the person by environment interaction. And as I suggested before, persons do go into situations with certain skills, many more than others. Like their leaders have many more skills because they've been required to do that in their job, and they're problem solvers. That's part of leadership. People that are not in a problem solving mode or don't have those skills would be at a lower capacity. But there is a famous article on ordinary magic that a author, Maston, did way back in the early 2000s. And the basic notion is that we all have some aspect of resilience and resilient capacity. And sometimes people surprise you, they can rise to the occasion given the situation. So basically the issue is there are person capabilities, there are situational features, and sometimes those are in sync. So the person can do very well and expresses resilience. But when they're in conflict, the same person may not be able to rise to that occasion or may not be motivated to do so. So you can see it is complex. I don't think everyone can be resilient all the time. The other thing that might be mentioned is that when teams win the championship, they're called resilient. And of course they survive. So in part they are. But often in the everyday language, it's used fairly loosely because it may or may not capture the underlying reality. But there's no question, if you win a championship, you probably are resilient as a team. So it does have merit there.
Right. All right, I want to turn now to some of the questions that our audience have been submitting, okay? So let me see if I can go here with one from Diane Price, who submitted a question that, how do you theorize your findings relate to children?
Sure. Well, the same process can be seen in a loose sense, except that for what they're thinking, children are not as advanced in their thinking. Some people would argue with that, but the idea is that they don't have a lot of life experience if they're 3, 4, 5 years old. But so their thinking is more childlike, of course, in terms of their capacity to put things together and make decisions. So the model can apply, but in a very different way, because children are thinking as a child. There's cognitive development that continues into adolescence and adulthood. So they're at the early stage. So what they do and think is quite different qualitatively from what a teenager or an adult or an elder would do. So those are, the model applies loosely, but has to be age relevant in order to be much better at understanding what children do, how they feel, and how they think. So of course, resilience is going to take a different flavor there. In fact, the resilience field began with research with children. And so it was questioned, why is it that some children grow up in very bad environmental conditions and yet they become successful? And that was a very interesting question in the early stages of the research on resilience.
Okay, great, thank you. We have another question from someone that asks, is spirituality a viable resource to help individuals cope more effectively with a difficult life event?
And that one I think is very specific to the person themselves. Some people really feel much more close to the ability to deal with issues with spiritual guidance, and they look for a higher power, for example, to God, or another type of spirituality, which is much more being in sync with nature. Other people really don't value or give much value to that, and so they would not be served as well by that unless they develop that interest. So what I found in classes when I asked folks to raise their hand, students to raise their hand about whether spirituality is helpful or not to them in terms of dealing with stress and difficult life problems, about half the class raises their hand and the other half doesn't. So what I tend to see is that it's very specific to the individual. Some people will use it and it helps them tremendously. Other people have other ways to cope effectively with difficult life situations.
Okay, thank you. All right, so here's, I think, a very basic question that someone asked, and it gets to sort of, I think, the the heart of what you've been talking about this afternoon, which is how can a person be exposed? How can a person be exposed to a difficult life problem, yet still not develop a trauma such as PTSD?
That's an interesting question, and we saw it in some of the cases that we look at. A person could say that the event that they had to deal with was extremely stressful, the top of the scale. But in further questioning about how they reflected on it, they seemed to say, well, but it didn't last long. So the pattern which seems to appear, something can be highly stressful, but for a short time. And as long as the individual is able to ultimately move that aside and they're no longer bothered by that stressor, they are not likely to develop a trauma, which is a long-term change in their central nervous system and the way they think and the way they feel. And so that becomes very negative. Where I think we see certainly trauma develop much more so are cases that develop post-traumatic stress disorder. And you see that a lot in individuals that are in combat, where they are in tremendously stressful situations for long periods of time. And ultimately, even if they come back and they seem like they can handle things, there is an underlying pattern of sensitivity to things that trigger these experiences that they had in the battlefield. There's also a line of research in first responders, looking at police officers, looking at firefighters, and then another line of research on vicarious, which is in part for those that you see a lot of death and destruction. And so that begins to affect the person as well. So there's a need to provide support services for those individuals that have seen many things. And even though they're tough and they've been able to handle themselves for a long time, there is a residual effect. So those are the kinds of issues that relate to the development of trauma. Ideally, people are not exposed almost nonstop to such stressful situations that they will develop some type of trauma, such as PTSD.
Right, thank you. All right, so another question that was asked is, what can be done to improve a community's capacity to provide effective mental health care to vulnerable sectors of their community?
Well, here we get into a systemic view. I believe that policies are very important, as well as community mobilization. And that combination, policies will provide the legal and bureaucratic mechanisms, but also the funding to provide services. But also communities would do well, although it's hard to do, to have the university, to have community-based agencies, to have stakeholders from the community come together and start planning for mental health services that can be helpful to the local community based on the population that's there and the kinds of issues that are affected. For example, some communities have a lot of violence. And so many years ago here, there was a gun buyback as an example of trying to reduce the violence in that very small community locally. That's one possible solution, but it gets more complex than that. Still, the idea is when community stakeholders can come together, they can then begin to plan out what is the best local solution for interventions. And of course, still the need is for policies and funds to be able to enact them.
Okay, great, thanks. Let's see, another question that we have is, what interventions can be designed, disseminated, and implemented as psychological inoculations to help vulnerable populations develop some resilience against toxic stressors and avoid the development of trauma?
And that's a hard question. And of course, we think of inoculations for like a virus in order to protect you. There is some work in psychology, as you know, on stress inoculation, where you try to expose the person to situations so they can rehearse the right thing to do. So when they actually see the situation or they're in it, they're much closer to what can be done to deal with it. It's not always one-to-one, but they have a running start. That's one of the challenges, however. As the environments have become more complex, such as with the coronavirus, we need more research and funding for that research in order to be able to find new ways that can work, that build on established procedures, but then you have to add more to it because the situation is new, novel, as you mentioned earlier, and we don't know exactly what's going to work best. So it's an ongoing process of research that also needs support in order to be able to find out what works in this situation, which is so different from what was going on 10 or 20 years ago. So the answer is still up to individuals that can begin to design those interventions, also with the idea of making them culturally relevant. And culture, of course, is also a community feature, not just ethnic minority, although that's part of it, but communities can be very culturally driven in terms of rural communities, pioneer communities way off, away from the city to inner city. So all these features are local, environmental, ecological factors that need to be taken into account for a true culturally relevant intervention that builds on science, but then it's tailored for the local community or population. Now, that's only a general answer. The details need to be filled in terms of specific communities and more research that knows or learns how they're best designed in order to work in that community or in others.
Okay, great, thank you. Another one from Barbara, who writes that I think resilience is a learned behavior as well, right? So what do you think of the role of practice and building more knowledge about situations to build resilience, especially teaching people to use their best behavior traits to build resilience? Of course, people have to know what their best behavior traits are, she says.
Well, that's a good point, absolutely. Well, it sounds to me like that question does tap into the stress inoculation work, where in a therapeutic setting, you can practice those kinds of behaviors based on a situation that's presented to you that's likely to occur. And then the therapist will give like coaching feedback. In other words, role play to try it out. And then based on timeout after a 5 or 10 minute role play, then feedback from the coach, the therapist, the helper, that gives feedback on how it could be done better. And it can be rehearsed several times. So that would be an approach that begins to build the person's capacity, but also worth developing the way to think on their feet, so to speak. What could they do so that they can deal with the situation more effectively? And again, there are individual differences. So this needs to be tailored to the actual person because they vary in terms of how they approach problems or go away from them. A very interesting issue. There's a lot of work to be done. There are principles that we can build on, but as I mentioned, those have to be modified to current new realities and of course to the individual based upon their personality and other features like the capacity to engage some situation or not be so comfortable doing that. So many different features. So it's a matter of having a standard intervention, but tailoring it to the unique individual. And more preventive and I think treatment interventions are starting to become tailored to the individual because that's really what's going to work best.
Okay, great. Let's see, we might have another one here. Okay, so what specific tools can we teach to our loved ones who live with mental illness so that they can better manage crises or life stressors?
That's a good question. And there are so many forms of mental illness, all the way from depression, schizophrenia, anxiety disorders, you name it. And so that also is part of the issue. For those that have schizophrenia, for example, there's a different profile of how they can participate. And even different kinds of schizophrenia, there are variations. For some, of course, there's medication. So that's the first thing to take, although if there are side effects, the individual doesn't want to take them. And then that creates some limitations. So it's a complex process. But I think one of the issues that I feel strongly about is that when I was in my training in social work, actually, it was the heyday of mental health services in the mid-70s. And those approaches for training as well as services began to be taken away. It's clear that now we have very little support for mental health services, an effort to increase them, but it's still very little compared to what was there in the past, in the 70s and into the 80s. So there's a need for more resources to be brought to the table in order to allow those services and those approaches to work. But I think I might have missed something from the question, Keith, if there's anything that I still didn't address.
I thought you covered it, but if Elizabeth wants, tools during COVID.
Some tools during COVID. Well, I would say one of them, of course, is the notion of emotion regulation. When we are concerned and fearful, it's hard to think straight. Yet in order to think straight and plan our activity, we need to be able to control those. But we're not alone. We can also ask for help, because that's important in bringing another resource that helps you to deal with the situation. As for example, I mean, it's a tool. You have a sponsor in addiction treatment, and that person is there for you and helps you to deal with threat situations that involve the high potential for lapse or relapse. So it's a systemic process that can include individuals from the family, or of course professionals. With that said, I think the issue of helping families as a unit become more sensitive to some of these issues and to serve as good sources of social support rather than lack of support, or trying to help but actually make things not work as well as they should. All of this calls for a systemic approach that brings in helpers of various kinds, so that the individuals that are affected by mental disorders that are more intense can be helped in a way that is going to improve the quality of their life. You can see that there's a lot of mobilization.
I think is really important, because Elizabeth added to her question, like the idea about what tools might be working during COVID, because what's specific to this COVID thing is how much we are now isolated as individuals,
Yes.
right? So I wanted to just see if you had any other thoughts that relate to the isolation, so that we can cover all aspects of the question that Elizabeth raised.
Absolutely. That's a tough one. And in nursing, we face that in terms of telemedicine, that can be a way to connect with people. The limitation, however, is that those are short periods. Hopefully they're very helpful, but they're not there in a regular period of time. And there may be a waiting list in terms of the appointment for that. So it's one approach which has grown because of the need. And it does affect at least the person is not as isolated, but it's only a short-term connection. And so that's a tough one in terms of a pandemic where you should distance, and yet because of doing that, you actually lose connections or not as well. Of course, we can do them through, the FaceTime and Zoom, and that helps. And I think that that's at least a stopgap measure for now. But there's no question that loneliness and feeling isolated, especially with elders, is a very big issue. And it's been aggravated considerably, as we know, by the pandemic. So those are issues that require further innovative approaches, so that those individuals will not be as forgotten and isolated as they otherwise would be. So it's hard, but a lot of it is mobilizing resources of various kinds to reduce the isolation and the feeling that no one is there for you. And that's an awful feeling, when you feel that you have no one that even cares or pays attention. So we need to reduce that gap.
Right. Okay. Let's do one more. Okay. Before we turn it back over to Mike Meyer. But we have Dr. Castro, your work is extremely interesting and so important. Thank you. I was wondering if you can talk a little bit about the funding opportunities for research like yours, and how individuals might be able to help.
Well, certainly, research to be done well is an endeavor that requires funding. And there is a need, of course, the basic paradigm is that the National Institute for Mental Health, NIDA, National Institute on Drug Abuse, and NIAAA for alcohol, all of those are entities that do have a process of submitting proposals and getting them funded. The issue is that the funding is so tight that many good research studies that could be done are not being funded. And you often have to go back 2 or 3 times, if not more, in order to finally get funded. So there is a need for other venues besides the US government, the Institutes of Health, to provide support for formative research or smaller studies that will allow actually researchers to have preliminary data that will be important in applying for a larger proposal. So Institute for Mental Health Research is a wonderful venue for providing that seed funding to build the database and the scientific underpinnings that can be used as the evidence to show that a bigger study can be done. And so that's one way that funding will help to move the process along. There are others, but certainly the foundations are another source. But long story short, good research requires that financial support because it's so expensive to do. On the other hand, the gain can definitely outweigh the cost of doing it when done well and when it makes a big difference in local communities.
Well, Dr. Castro, thank you so much. This has been wonderful. We totally appreciate your time and all of the effort that you've put into this and the excellent answers to all of the questions. And I think that your last answer in particularly is a great segue for us to turn things back over to Mike Meyer at this point. And thank you once again.
Great. Dr. Castro, thank you. If anybody has any questions for Dr. Castro or for or for Keith or any of us, please again email us. I just want to personally wish everybody on this webinar a good and safe Thanksgiving. The question at the end about isolation, I think everyone is feeling this. We got some very good news, as all of you know, last week and this week about treatments from Eli Lilly and about the vaccines. So I think hope goes along with resilience. And I certainly hope that as we get to the next summer that we can even do some of these events in person. In terms of the question on resources, you'll notice that we have a list of mental health resources that are up on your slide. We can certainly get this to you and it's also on our website. Feel free to help us in any way you can. If you'd like to buy a t-shirt, you'll see that we have those. And then also go to our website at imhr.org. You can find a history of the work that we've done. You can see our newsletter. You can see what we're doing now. And again, I thank you so much for joining us for this webinar.